So Asian eyelid surgery can be broken up into maybe 5, maybe 6 categories. So let's take a look at those. For younger patients who don't have a crease, or maybe they have some crease asymmetry, double eyelid surgery or anchoring technique is what you're usually using. Now that's typically either incision technique or a combination of incision and suture technique to create a double eyelid that either isn't visible or doesn't even exist, and you're just creating new anatomy. Now the next category that is also very common in the clinic is asymmetry. This is someone who has 2 eyes that actually look pretty good. Maybe one side has a crease and the other side doesn't, or the 2 creases are a bit different. And you're performing a similar surgery as you would with double eyelid surgery to just create 2 creases that match one another. Related to that would be ptosis in the context of Asian eyelid surgery, and this can be very complex where you're trying to adjust the position of the eyelid through manipulation of the levator tendon, or even performing what's known as a Putterman procedure on the posterior aspect or the inner layers of the eyelid, and that's to adjust eyelid position. And then at the same time, you have to create 2 creases that are as symmetric as possible and also look natural and appealing to the patients, and it's in keeping with their goals, and that's a real challenge. In addition to that, you have a category that could be age-related changes. Now this could be something that's very mild. Maybe the creases become a little bit loose, the brow is a little heavy, or the skin is a little loose and the creases changed position over the years. Or it can be more severe, where there's excess skin, the crease itself is loose, there's maybe even some ptosis on top of that, and there's volume loss either of the upper and lower eyelids or the periorbital area, or the area right around the eyes. Now beyond all of that, and this can occur for patients, or this can be a situation for patients at any age, is revision Asian eyelid surgery. Now, it could be fairly simple, where the patient's only had 1 surgery and there's only some minor corrections to make, or it can be really severe, where the patient is usually a little bit older than, say, 30, 40, or 50, and they've had anywhere from 1, 2, or even 6 or 7 surgeries in their entire lifetime. And the amount of work that it takes to correct a situation like that can be quite a lot. It can be 2 or 3 times the amount for all these other categories that I described, and it can require a lot of other techniques that I'll go into more detail about a bit later. So let's start covering these different topics in more detail individually.